So you're presenting a treatment plan to a patient. They seem like they're tracking along with you and understanding everything that you're saying. And you finally get to the point where it's decision time. Based on the indicators that the patient was displaying up to that point, you're fairly confident that they're going to go ahead with the treatment plan that you're recommending. But then you get to hear those dreaded words. I want to think about it. Let me talk to my spouse about it. I only want to do what insurance covers. I'm very busy right now. I mean, I could go on. All of these we classify as objections. So part of closing a patient to do treatment, or selling anything for that matter, is being able to handle objections. And that's what I want to talk about in this week's tip. So when we're talking about objections, the first thing you have to be able to do is identify what kind of objection you're dealing with. So objections fall generally into two basic categories. The first category is a real or valid objection, a real or valid reason for the patient to not proceed with treatment right now. The second category might be what we'd call a faulty or an unreal objection, which a better way of saying it is it's just sales resistance. We all have a degree of sales resistance. You know, for example, let's say you're at the mall and you are just trying to kill time and you walk into a store and you're sort of looking around. You didn't go into that store with a purpose to buy anything. You're just walking around to kill time. Believe me, I've done plenty of that in my lifetime. And so you start looking at, I don't know, some pants or a jacket or something like this, and whoop, the salesperson comes up to you and says, "Can I help you?" Well, you're not really interested in buying anything right now. You're just looking. So what do you say? "I'm just looking." Instant sales resistance. You're not trying to actually actively buy anything at that point in time. We all have a degree of sales resistance. And when a patient comes into your practice, they're not necessarily coming in going, "Gee, I want to buy something today." That's just the general nature of humans, okay? So in order to understand these objections further, let's look at the characteristics of each. Let's start with a valid or a real objection. A valid or real objection has three basic characteristics. Number one, it sounds rational. It seems legitimate. It seems like a pretty good reason. Number two, the patient sticks to it, or the person if you're selling something other than dental treatment, meaning it's always the reason they don't want to do it. You'll notice with an unreal, faulty objection or a sales resistance, a person changes their objection continually, which I'll talk about in a second. But with a real or valid objection, the person sticks to it. This is the reason. Point number three is a person who has a real or valid objection is communicative about it. So let me give you an example of a real or valid objection. So you're explaining a treatment plan to a patient. They understand it. They want to do the treatment, and then it comes time to where they're actually supposed to do something. Let's say, I don't know, it's a $12,000 case. And they say, "You know, doctor, I'd love to do this treatment plan. Here's the problem. I can't apply for financing right now because I'm in the middle of buying a new house. And my banker said, or the person I'm getting the loan from said, not to apply for any credit and don't make any large expenses before I close on the house. I'm supposed to close on the house in 3 weeks. So after that, I'd be more than happy to apply for financing." Now, if you were to press further, which you probably wouldn't, but let's say you did, well, what would happen if you did it now? But listen, I really need to finish doing this first because if I, apply for credit right now, I may be in a situation where I no longer qualify for my house. The person may even volunteer more information. I could probably put this on my Visa card. I have enough on there to cover this, but again, I can't use it right now. Do you see, they're communicative. They're telling you all about it. They're not just saying, "I can't afford it," or "This is really expensive." They're being communicative. Or let's say, again, you're presenting a large case and the patient says, "Gee, I don't know how I'd come up with the money for this. I mean, I only have $5,000 available on a credit card. I think I have about $3,000 in my checking account. Maybe I could pay part of it. I don't really know." This is a person actually giving you real data, okay? This is real or valid. So what about a unreal or faulty objection? What does that look like? Well, number one, the person changes it frequently. So let me give you an example. You're talking to a patient about treatment and they go, "I don't know, I'd never be able to find the time to do this. How long does this thing take? Yeah, I'm just really busy right now." Then you keep talking to them a little bit more, which most people don't do. They go, "Oh gosh, I'm so sorry you're so busy. We'll talk about it later." But let's say you go, Well, let me just explain a little bit more about why you need this now and why I would rather do this now than later. You explain it some more, and then it's, maybe I only want to do what insurance covers. How much does my insurance cover? So basically, you're running into sales resistance there. It's, push you away, push you away, push you away. This is not a valid or a real objection. This is just sales resistance. The person changes it. The other thing that you'll find with sales resistance is the person is not communicative. I'm really busy right now. I can't afford this. This is really expensive. Or my favorite, I want to think about it. That one's great. Because if you really think about it, the concept of thinking about it, what does that actually mean? You've just told me I need 3 implants. Am I going to go home and take the literature about implants and sit at the table and do this? No, of course I'm not going to do that. What it is it's a nice way of saying no. Now, maybe you've had this happen, but I've run into very few doctors who have. Maybe you've told a patient what they need, and I've never seen this before, and they just go, no. Nobody does that. So what do they say? I'm going to think about it. This isn't a good time. I've got a lot going on right now. It's a nice way of saying no. That's really all it is, okay? So there's your 2 different types of objections. You have your valid or your real one, and you have your faulty or unreal objection, which is really just sales resistance. Now, before I get into what to do about these 2 types of objections, I'm going to give you one other one that could either be valid or it might just be sales resistance. And this one is, I need to talk to my spouse about this. Now, this is a tricky one because, okay, full disclosure, I've used that one before when I just don't want to be sold something. Hey, Jeff, do you want this couch? I need to talk to my spouse. It's a stupid example. Of course, I wouldn't buy a couch without talking to my wife. What's this couch doing here? Anyway, but the point being is, that would be silly. The point being is it's an easy way to blow somebody off, but it also might be a valid reason for not doing something. So, that one you're going to want to question a little bit more. So let's say you've explained the treatment, the patient knows how much it costs, and they said, this looks great. Listen, I need to talk to my spouse about this. Well, the first thing I would check in that case is I'd say, okay, I understand. Do you actually want to do this treatment? That really is a question you should be asking before you get into financial discussions anyway. Do you understand what this is? Good. Do you want to do this? Because if the person says, I don't know, maybe, well, they're not sold, okay? Let's say instead, you ask me, I've told you I have to speak to my wife before I proceed with treatment, and my answer, and you ask me, do I really want the treatment plan? I say, yeah, of course I want the treatment plan. I just have to talk to my wife. We have an agreement where we will not spend over a certain amount of money without discussing it first. Now, you might ask me at that point, well, what do you think she's going to say? And I might say, well, she's probably just going to tell me to do it. It's more just a courtesy we've both agreed upon. If it's something that we really need, we at least discuss it first. Well, in that case, fine. I'm going to talk to my wife and let you know. Now, you could have, there are different ways of handling that. You could have me call my wife if I'm comfortable doing that. I've seen some people do that. I probably wouldn't. It really depends on the person. Some people might say, yeah, I need to talk to my wife. You know what? Let me go call her real quick. In which case, fine. If the person doesn't seem comfortable calling their wife right there while you wait, then maybe that's not the best way to handle that. So let's say you've asked me, what do you think your wife is going to say? And I say, yeah, I don't know. She's going to think it's a lot of money. Well, then in that case, I might do something a little bit differently. Because when I bring that treatment plan home, you've just spent 20, 30 minutes with me explaining my treatment plan. So I have understanding of what you're trying to tell me. But when I go home, and I show it to my wife, because part of understanding, keep in mind, is knowing how important something is. That's part of understanding, how valuable it is, how important it is. So I know. That's why I want to do it. When I go home and talk to my wife, she didn't spend 20, 30 minutes with you. So what is going to be most real to her is the number at the bottom, because that is real. Money is real. Everything else that you've just explained to me, she wasn't present for, so that's not real to her. So in that case, what I might do is say something along the lines of, listen, if you need to speak to your wife about it, here's what I'd be happy to do. I could have you both come in. I could sit down with both of you, answer any questions that she might have too. You could also possibly do it over Zoom. Assuming that there's a degree of HIPAA compliance there, I leave that up to you to find out. But if you're concerned that they're not going to be able to explain it to their spouse or there might be any problems there, then I would take it upon myself to explain it to their spouse myself. Now, there's a side benefit to this. What if their wife doesn't have a dentist? Let's say my wife didn't have a dentist, you might get a new patient out of the deal. So that's what I would do. Bring them back, do it over the phone, however you have to do it, if the person says they need to speak to their spouse and it is a valid objection. Now, let's take it on the other side. I tell you, I've just told you I'm very busy, it's too expensive, blah, blah, blah. And you've kept talking to me, and then we get to the point where I go, yeah, you know what, I'm really gonna have to talk to my wife about this. You go, well, what do you think she's gonna say, Jeff? Yeah, I don't know. Well, we'll see what she says. I talked to her, and she may say yes, she may say no. Let's see what she says. And then you ask me, Jeff, do you really wanna do this treatment plan? And my response is, yeah, I guess. Well, at that point, stop talking about money. And this would apply in any objection. If I want to think about it as what you're hearing, and then you ask me, Jeff, do you really want to do this treatment plan? And you don't get a definitive yes, or yeah, I know I have to, go back to explaining the treatment plan. I don't want to do it. Why would we argue about me scheduling or paying for something that I don't want to do? That just seems stupid. So go back and handle me on why I need to do it in the first place, and those objections might evaporate. So that's where you may see it from time to time, where I need to talk to my wife or I need to talk to my husband. It's just a blow-off, okay? Versus when it's legitimate, they really need to speak to their husband or wife. You might even ask questions if it seems legitimate. What would happen if you went ahead and did it now? Let's say you asked me, Jeff, what would happen if you just went ahead and did the treatment now? I go, well, then I would be sleeping outside. That's a legitimate objection, okay? In which case, you're gonna have to talk to the spouse. In the other cases, I won't stick to it very long, or you might find out that I don't want the treatment in the first place. Which brings us back to, when you finish explaining treatment, before you get into finances, that should be the first question that you ask before you get into discussing money. When I say, hey, doctor, how much is this? You go, okay, before we get into finances or the fees, first question is, do you wanna do this treatment? If there's anything other than a definitive yes, go back into explaining the treatment plan. What are you concerned about? What is it that you wonder? Well, it just seems like it might be very expensive, or it might hurt, or I don't like getting shots. You're gonna get the real reason I don't wanna do it, and you're not gonna run into a lot of those objections in the first place. So now, how do we handle all of these objections respectively? Well, the first thing you're gonna do with any objection you're ever given, first thing, is you're going to acknowledge it. Now, what does that mean? You say, whether it's valid or invalid. So you say to me, Jeff, the treatment plan is $12,000 and I'd like to get started right away. And I say, doctor, this is a big decision. I really need to think about this. What is the first thing you should do? Jeff, I understand. Acknowledge me. Because if instead you go, Jeff, what do you have to think about? Well, you really need to do it right now. I feel like I am not being heard. When people feel like they are not being heard, they get upset. If you want any proof in your life, think about when you were a kid or with your spouse, when they yell upstairs. Let's say mom yells upstairs to the kids, it's time to go to school, and there's no response. And then she yells again, and there's no response. How does the third and fourth yell sound when she's not being heard? It starts to get pretty heavy. When a person feels like they're not being heard, they're going to get upset. So make sure that the first thing you do is acknowledge the objection when you get it, okay? I understand. I'm very busy right now. You're a busy person, I totally get it. Now, if it's a legitimate objection, a real objection, one that makes sense, they're getting a refinance, they're leaving the country tomorrow, I'm gonna understand this objection and work with the patient. Will I lose some of these closes? Absolutely. But this is a real thing that's going on right now. What am I gonna do about it? I can't perform magic and make the objection go away. I've acknowledged it. I'm gonna work within whatever constraints that they have to get the treatment plan done. But let's say we're talking about basic sales resistance here. Now, in that case, it really depends on A, what the objection is, and B, the person you're talking to. Let's look at a couple examples. Let's say you're talking to me and I say, wow, doctor, this is a lot. I'm really busy, I only want to do what my insurance covers. I would acknowledge me, and then I would go back to the treatment plan, start explaining it again. Not robotically the same thing that you just explained. Maybe go back into one particular point. I totally got that you want to do insurance covers. Let me just show you one other thing about this. Be a little bit persistent, okay? Or I tell you, I'm really busy right now. I get it. I totally got it. You're a very busy person. I understand. I do understand. Now, I just want to show you one thing. I want to explain a little bit more about why this is important to me to get done sooner than later. And go right back into explaining it. Because if I'm giving you sales resistance for something, this is a little different than me walking into the store to buy a pair of pants. This is dental treatment that I actually need. So if I'm giving you sales resistance, it means one of two things. One, I don't understand what you're explaining to me, which could be very valid in a lot of cases. Or two, there's something else going on that I am not telling you. Maybe I'm terrified of drills and needles. I hate going to the dentist. Maybe, who knows? Who knows? Maybe I'm price shopping. There's something else going on in my head I'm not saying. So what are you hearing instead? I'm busy. I need to think about it. This is really expensive. So those are the two things going on with me. So depending on the person and depending on the objection, you'll either A, just direct them back to the treatment plan, maybe find one unique point to keep discussing about it, or B, let's say I say, doctor, I really need to think about this. You might say something like, Jeff, I completely understand. This is a big decision. Now, let me just say something to you. Normally when somebody tells me they want to think about it, there's usually something else that is on their mind. Now, I'm your doctor, okay, and it's important to me that we get you healthy. Whether we do this now or later, whatever it is, I'm here to get you healthy. So I also wanted to make it completely clear that you can tell me whatever it is you're thinking, and I'm happy to help you with it, okay? So what is it that you're concerned about if we were to start now? And then it might all come out. Oh gosh, I'm worried about getting fired, in which case that might be a legitimate or a valid objection, right? Or because they're gonna have no money. Or I hate drills and needles. Or I got a root canal once and it really hurts. I mean, who knows? Whatever's rolling around in their head, you're gonna get it because you're actually getting into good communication with the patient, okay? So there you have it. You have real or valid objections. You have basic sales resistance. We have I want to talk to my spouse, which could be either depending upon the situation. And remember, if a person's just giving you sales resistance for something that they validly need, either A, don't understand it, or B, there's some other thing they're thinking that they're not saying to you. So that tells you a couple things here. Number one, is extremely important to establish good communication with the patient. It's not just that you're the doctor and you come in and you tell them stuff. They feel like they can talk to you. That's important, okay? Number two, you have to make sure that you're allocating time. I've talked about this in other tips. I've also talked about it on the MGE podcast. I'll put a link to that on the description below, about allocating time to actually sell. In dentistry, we allocate time for diagnosis and we allocate time for treatment, but we don't allocate time to actually explain the treatment, which is why you're probably not doing as much treatment as you'd like to because you don't have time to actually explain it, which is the whole subject of another tip. But beyond that, one thing I would highly recommend if you really want to get control of this area of your practice, case acceptance, is to check out the MGE Communication and Sales Seminars. We do them every month. I'll put a link to them in the description below. And in those seminars, you'll learn everything you need to know to increase your case acceptance. So that's all I have for you this week, and it was a little bit of a longer tip, which I guess when you see my face, you know is going to happen. Don't forget to subscribe to the channel if you like tips like this and you'd like to see more, and click the notification button if you want to know when we come out with a new one. Otherwise, if you'd like to know more about MGE, you can find us at mgeonline.com or call us at 800-640-1140. Folks, have a great week, and we'll see you at the next tip.